guys, Khadija here with Nursekayexplains, and today in this video, I'm going to be going over IV flow rate. So it's initially going to be some easy IV flow rate questions, and it's going to progress to more harder questions, and then we're going to end it off with a heparin IV case study. Feel free to work along with me. I'll be working out these problems in real time. So I'll put the question up. You can pause the video when you see the question up, and you can go ahead and work it out, or you can just watch me work it out. Or we can do it together. However you want to do it, whatever's the best way you feel like you will learn these problems. Milliliters per hour. So we're going to put milliliters up here. Over 6 hours. And remember, we can check our math, right? So there's nothing we need to cancel out because look, we have milliliters and we have hours, which is what they're looking for. So all we have to do is do our math of 1,000 divided by 6, which is 166.7 milliliters an hour. And remember, they wanted us to round to the nearest tenth, okay? So again, with that rounding that we did previously, you see we just have one number after the decimal. So this is simply the same. Don't let the amount of wording in the problem get you hooked up and make you think that it's more than what it is, okay? We're doing milliliters an hour. So remember, going back to our basic conversions, there should be a milliliter here, right? Right next to it. So 500 milliliters. And what do we know? What do we have? We have over 90 minutes. But we're not done because they want us to figure out milliliters an hour, right? And this is milliliter per minute. So in order to do that, we know that 60 minutes is in 1 hour. Now we can do our math. Let's check our math. So we're able to cancel our minutes out, and we're only left with milliliters in hours, which is what they are calling for. So now we just simply do the math. We're going to do 500 times 60, which is 30,000, divided by 90 times 1, which is simply 90. So 30,000 divided by 90 is 333.3, okay? Because remember, we're rounding to the nearest tenth, okay? So we should have just one number after the decimal, which we have. They want us to figure out 500 milliliters infused over 4 hours and 15 minutes. Make that 4 hours and 15 minutes. I'm just going to make it 4.25 hours. Just like 4 hours and 15 minutes. This is going to be 0.25. 4 hours and 30 minutes will be 0.5. 4 hours and 45 minutes will be 0.75 hours. So you just converted that minute to hours, basically. Let's do milliliters an hour equals 500 milliliters over 4.25 hours. And again, we don't have to cancel out anything because we have what they're asking for, which is milliliters an hour. So the answer is 117.6 milliliters an hour. And drop factor, you'll see at the top corner of your IV packaging. Typically, it's on the top of your IV packaging. But in these equations, whenever they want you to get drips per minute, they will always give you either a drop factor or they'll say micro drip tubing or macro drip tubing, okay? So let's do this. And all these equations will give you the drop factor. So they want us to get drops per minute. So here, we're going to put our drops first. This is what they're asking for, okay? So the drop factor is 20 drops in 1 ml. Okay? And then we're doing 1,000 ml over 4 hours. So let's check our math. So the milliliters cancel out. Oh, look, we're not done because they don't want us to get drops per hour. They want us to get drops per minute. So what do we do here? In 1 hour, that's 60 minutes. So if you cancel out your hours, now you're left with drops and you're left with minutes, which is what they are looking for, okay? So we're just going to do our math, which means we're going to multiply across first at the top, and then we're going to multiply across at the bottom. So 20 times 1,000 times 1 is simply 20,000. And then 1 times 4 times 60 is 240. So now I'm going to divide the top and the bottom. Do 20,000 divided by 240, and that is 83.3. However, they want us to round to the nearest drip. So remember, using what we learned in rounding, the nearest whole drip, because this number is less than 5, we're just going to go to our nearest whole number, which is 83 drips per minute. Drips per minute is what they're looking for. So they gave us a drop factor of 60 drips over 1 ml. And y'all know that if you see just ml, you're just assuming that that's 1 whenever you see that in a dosage calculation. I don't think I mentioned that earlier, but that's why I'm putting 1 for our drop factor, because they put 60 drops over an ml, which is the assumption of 1 always, okay? So what did they give us in our problem? They gave us 500 milliliters over 4 hours, but we're not done yet because they want us to do minutes. So in 1 hour, it is 60 minutes. Okay, so now let's check our math, okay? So hours is canceled out, milliliters is canceled out, so we're left with drops, so we're left with minutes, which is what they're looking for. So now we're going to do our math, okay? So we're simply just going to do 60 times 500 times 1 is 30,000. Bottom row, 4 times 60 is 240. So we're going to do 30,000 divided by 240 is 125 drops per minute. Remember, rounding to the nearest whole drop as well. Drops per minute. Our drop factor is 15 drops over 1 ml. And then we look at what they gave us in our equation. That's 200 ml over 2 hours. There is 1 hour and 60 minutes. So this is just all conversions, okay? Once we're there. So let's make sure we set up our problem correctly by canceling out unnecessary. So we have hours and hours. We cross out milliliters and milliliters. So now we're left with drops and minutes, which is what they're looking for here. So we know that we got our problem set up correctly. Now we can do our math, which is 15 times 200, and that is equivalent to 3,000. And then we're going to do 1 times 2 times 60, that's equal to 120. So now we're just going to divide our top row divided by our bottom row, which is 3,000 divided by 120, and that leaves us with 25 drops per minute. We're going to start out with what they are asking us for, which is drips per minute, right? Now we're going to pull from our problem. So we're going to start with drips, which is our drop factor. So they gave that to us. They told us that we have 15 drops, and we know that's over 1 ml. And on hand, we have 200 milliliter bags of Cipro. So this is what we have available. We have a 200 milliliter bag of Cipro, and that contains 400 milligrams. So this is what we have. So if you look at the IV bag, it's 200 milliliters of volume of the fluid, but there's 400 milligram dosage of the medication inside that bag. Now we're going to put what is prescribed by the doctor. So the doctor prescribed 400 milligrams, and he wants us to get that over 60 minutes. Okay? So this here is what we have available, and this here is what the doctor ordered. So let's make sure that our problem is set up correctly before we do the math, okay? So we can cancel out our milligrams, we can cancel out our milliliters. That leaves us with drops in minutes, which is what our problem is calling for. So we know that we set up our problem correctly, okay? So now let's do the math, okay? So 15 times 200 times 400 is 1.2 million. Okay? And now we're going to divide across on our bottom row, which is 1 times 400 times 60, and that is equal to 24,000. So now we're just going to divide 1.2 million divided by 24,000 is equal to 50. So our answer is 50 drops per minute. Calling for us to get milliliters an hour. So we're going to pull from our problem, okay? So what do we have available? We have available 100 milliliter bags of gentamicin, and it contains 125 milligrams of gentamicin at that in 100 mLs. Okay? Now, we're going to have to put milligrams here as well, because remember, we're going to cross out. So what we have on what the doctor ordered is 7.5 milligrams per kg per day. And it says here that our patient is 220 pounds. So what I do when I deal with weight is I typically calculate the kilograms outside of the problem. And I'll talk about that a little later when we get to our IV heparin case study. But for now, I'm just going to do 220 pounds divided by 2.2, because we know that 2.2 pounds is 1 kilogram, okay? So I just went ahead outside of the problem and calculated my patient's weight and converted it from pounds to kilograms. So my patient's 210 pounds, but that's the same equivalent to 100 kilograms. We're going to put that over 1. And the doctor wants the patient to get 3 divided doses in 1 day. So in 1 day, the doctor wants 3 doses. He wants the patient to get 1 dose over 2 hours. So this is a long problem here, okay? This is multi-step for sure. So let's check our math, okay? So let's see. Dose and dose is canceled out. Day and day is canceled out. Kilograms and kilograms is canceled out. And milligrams is canceled out. Okay? And like I stated earlier in my video, in order to cancel something out, you must have one on the top as well as the same unit on the bottom. So you see we have milligrams on the top and milligrams on the bottom. Kilograms on top, kilograms on the bottom, and so on and so forth. So we know that we set up our problem correctly, and we're only left with hours and milliliters, which is correct because that's what they're calling for. They want us to get this in milliliters per hour, okay? So now we're just going to do our math. So 100 times 7.5 times 100 times 1 is 75 Okay? And then 125 times 1 times 3 times 2 is 750. So now we're just going to do 75,000 divided by 750, and that is equal to 100 milliliters an hour. Okay, y'all got that, guys? And anytime you have a patient with their weight, like if you have an equation that has kg per day, like how I did this, you're just going to put a 1 on here just to fill that box in, okay? But your kg a day is down here, and you should have kg a day at the top as well, okay? And what do we have available? We have available dobutamine, 250 milliliters. We're going to start with milliliters first, remember? So we have 250 milliliters of fluid with 500 milligrams of dobutamine in it, okay? So we know that in order to set up our problem correctly, we should have milligrams here. So that means we have to convert, because our problem doesn't give us milligrams at all. Our problem, only thing that gives us the milligrams is what we have available. So we're going to have to convert, okay, guys? So the doctor ordered 10 mics per kg per minute. So we're going to have to convert milligrams to mics. So we're going to look at our conversion chart, and there is 1 milligram is the same equivalent to 1,000 mics. So we're going to put 1 milligram here, just so we're making sure that we're setting up our problem correctly, over 1,000 mics. 10 mics per kg per minute. The patient weighs 80 kilograms, or I said kg. The patient weighs 80 kilograms. And we'll put that over 1. And in 60 minutes, there is 1 hour. Before we check our math, let's make sure we set up the problem correctly, okay? So we're canceling out minutes, we're canceling out kilograms, we're canceling out micrograms, we're canceling out milligrams. So that leaves us milliliters an hour, which is what we have, okay? So now we're just going to multiply across, which is 250 times 1 times 10 times 80 times 60. That equals 12 million. Now we're going to multiply across on our bottom row. So 500 times 1,000 equals 500,000. And then we know once we go back into our calculator and do 12 million divided by 500,000, that's equivalent to 24. So our answer is 24 milliliters an hour. So now we're on to the last portion of our video, which is the IV heparin case study. You're going to need to look at this in order to solve your problems and get your answers. You're going to need to know about the patient. You're going to need to know about your medication as well as your orders. You have that on your screen. And then this box here that we have is our heparin protocol on how we adjust heparin. Remember, heparin is an anticoagulant, so we do not want to give the patient too much, but we also want it to be therapeutic. This patient has a DVT. So no, we don't want him to bleed out, but we also want that clot to dissolve, okay? Which is why he's getting that medication. So heparin is a high alert medication. Whenever you're giving a bolus or making adjustments on your pump, you have to make sure you have 2 nurses verify. And when 2 nurses verify, that does not mean that, you change the pump and then you say, hey girl, or hey guy, look at this. And they say, okay, I see. Like, no, you have to do your math. They have to do their math and look at the orders. And y'all both have to independently make sure that it is correct, okay? And both of y'all answers should match. So looking at everything that we have here, let's go to problem number 1. So in order to do this, we will need to look at our orders. So units equal. So 80 units over 1 kilogram. I say kg. And then the patient, how much does the patient weigh? Let's go back and look at our patient information. The patient weighs 220 pounds. So I'm going to calculate the patient's weight outside of this problem, and I'm going to tell you what I'm talking about here next. But if I were to do 220 pounds divided by 2.2, that equals 100. So it's the same thing. And so I just did a conversion. I just looked at my conversion chart and did a conversion. So 80,000 times 100 is 8,000 units. And we know that we got that right because when we cancel out, we're only left with units. Talked about this in the previous math problem. Whenever they give me a problem with pounds, I go ahead and convert it to kilograms outside of my math problem just to condense it a little bit. But if you don't do that, you will still get the same answer, and I'm going to show you here. So units equal, we know that 80 units over 1 kg. So we're going to convert inside the problem. We know that 1 kg is equal to 2.2 pounds. Our patient weighs 220 pounds. So let's do our math. Our math should be the same, right? Because it's the same problem. The only thing I did differently is that here I converted it inside the math problem. Here I just did it outside of the problem. So 80 times 1 times 220 equals 17,600. And then we'll do 17,600 divided by 2.2, and that is equal to 8,000 units. So see, the answer is the same. So you see here, the initial bolus orders is 80 units per kg or kilogram. But say, for instance, if the patient was 175 kilograms, his weight would make, it would supersede the max. And I'm going to show you what I mean by that. So let's see. If we're looking for units, and we know that 80 units, like I said, let's say if the patient was 160 kilograms, and let's calculate that. We're just pretending like the patient was heavier than what he really is. Like I said, the patient himself is 100 kilograms. So let's say he was 160. So 80 times 160 is 12,800, okay? So if the patient weighed 160 kilograms, then his bolus dose would be 12,800. But look, if you look at your orders here, it says the initial max bolus is 10,000 units. So you would not give this patient 12,800 units. You would give them instead just the max, which is 10,000. This is why it's important to nurse dose check, okay? So I just wanted to show you guys that real quick. Calculate the bolus dose in milliliters, okay? We have the heparin vial for bolus is 5,000 units per 1 ml. Our initial bolus is, like I said, 80 units per kilogram. So in 1 milliliter, it is 5,000 units. And then the bolus order is 80 units per 1 kilogram, and the patient is 100 kilograms. So let's check our math. So kilograms cancel out, units cancel out, and that just leaves us with milliliters, which is what they're asking for, so we know that we set up our problem correctly. Now let's multiply our top row across. So 1 times 80 times 100 is equal to 8,000 divided by 5,000 times 1, which is 5,000, which give us our answer of 1.6. So you will give this patient 1.6 milliliters of heparin. And then heparin, I'm not sure what level of clinical you all are in yet, if any of you have given heparin yet, but heparin is usually given in, just like this problem states, 5,000 units of 1 ml. I'll insert a picture here. As you can see, you've probably given heparin, subcutaneous. We give heparin as VT prophylaxis in the hospital. However, it can also be given intravenously. So this is what we use to give our IV boluses. A lot of facilities do not give boluses of heparin on the IV pump itself. They will withdraw the medication from this valve here and give it that way. Okay, so for this patient, just a little bonus, we will need to take out 2 valves from our Pyxis or Omnicell machine, or wherever you get your medication from, in order to withdraw 1.6 milliliters. Because as you can see, in the valve that we have available, we only have 1 milliliter per valve. So we will need to take out 2 valves in order to withdraw the appropriate amount of medication, which is 1.6 milliliters. So our doctor's orders is 18 units per kg an hour. The patient is 100 kilograms. We're going to do our math now. 18 times 100 equals 1,800 over just 1 that we have there. So the answer is 1,800 units per hour. And we know that's correct because when we cancel out our kilograms, we're only left with hours and units, or units in hours, which is what they call for here. So we got to start out with mLs. So now we have to look and see what medication we have available. So we have 250 milliliters over 25,000 units. The initial infusion rate is 18 units per kg an hour. The patient is 100 kilograms, I say kg. The patient is 100 kilograms. So let's do our math now, okay? We can cancel everything out. So we cancel out our kilograms, we can cancel out our units. We're left with milliliters and we're left with hours, which is what they're looking for. So we know we did our math correctly. So now let's now that we set up the problem correctly, let's do the math. So let's do 250 times 18 times 100. That is 450,000. And all we have down here is 25,000. So basically we're doing 450,000 divided by 25,000. And the answer is 18 milliliters an hour. So that's how we got that. Now, okay guys, so my camera messed up only for this problem only. So for this problem, I'm going to explain what I did. So basically, we are trying to figure out how much to decrease the pump by in milliliters an hour. We know that he currently has an infusion going at 18 milliliters an hour, but when we look at our chart, we see that based on his current PTT level, we need to decrease our infusion by 2 kg per units an hour. So when doing this problem, we start with what they're requiring of us, which is milliliters an hour. So we got 250 milliliters over 25,000 units. So that's the heparin that we have available. We know we need to decrease the infusion rate by 2 units per kg an hour, so that's what I put there, and we know the patient weighs 100 kilograms. So when we multiply our top row, 250 times 2 times 100, that's 50,000, and then our bottom row, all we have is 25,000 units, so we divide 50,000 by 25,000, and that gives us 2 milliliters an hour. So we need to decrease our pump by 2 milliliters an hour. Now let's get back to the video. 16 milliliters an hour because we decreased the pump by a rate of 2 milliliters. Until we get two consecutive therapeutic heparin dosage ranges, we'll continue to check our PTT every 6 hours. So it's 8 o'clock now. We made adjustments to our pump. So in 6 hours, we're going to check our PTT again. If that PTT comes back therapeutic within our dosage range, we'll check one more. And if that is therapeutic, we will change our orders to daily per our standing orders. Go to your hospital. The protocol is very similar to this. Now, the last problem at 1400, your PTT came back at 65. At what rate will you reset your pump? So because at 1400, your PTT came back at 65, there is no change because as you can see, it's within the goal rate as I was stating previously. So basically, you will continue to drip and recheck the PTT in 6 hours. So if you feel like you got value from this video, make sure you like, comment, and subscribe. Also, if you have any suggestions for any other content that you would like to see here or like me to create, please leave your comments below. Don't forget, I have the link down below for free conversion charts. You can download them in an unlimited amount of times. It will go directly to your email. Also, don't forget that I have a free ebook, and I have a link for that as well, The Ultimate Guide to Mastering Nursing School. If you have any questions, feel free to send them my way, and I'll be sure to respond to you all. Until next time, see you all later.